Hey there, everyone. Welcome back to another episode of the Growth Room podcast, where we dive into all the facets of healthcare with experts who are leading the industry. Please join me in welcoming Jeremy Vanderknyff, the Chief Integration and Informatics Officer at ProactiveMD. Thank you so much, and we appreciate you for joining us, Jeremy. Can you please tell us about yourself and what you do at ProactiveMD?
Hey, thanks for having me, Sal. My name is Jeremy Vanderknyff. I'm the Chief Integration and Informatics Officer at ProactiveMD. Fancy title, but means I wear a few hats for the organization. Among them, I lead our data, our technology, and then our product and marketing teams as well. We at Proactive, we're an advanced primary care company, so we partner with employers and health plans to be able to provide patient-centered medical homes. We build them and operate them so that people get great health care that may not ordinarily be able to access it.
So, what is your workflow like? What is it like to be Jeremy for a day?
Switching from meeting to meeting, all those different hats I wear. On a typical
Hello?
day, it's working with our teams to be able to identify what's happening within the business, where are those opportunities that we can better serve our patients, better serve our clients. And from a data perspective, sometimes that means being able to work through analyzing medical claims to be able to understand what's going on within the health of a population we serve, or being able to figure out, all right, let's gather some requirements to figure out how do we make the user experience better on our patient portal for our providers or our patients to be able to better communicate and engage one another.
Interesting. So, do you use technology to do all this analysis and review? And how critical is technology at your organization?
It's the year 2024, so technology I think is critical to pretty much every organization these days, and definitely within healthcare as well. So at ProactiveMD, we have a national footprint. So we're as far west as New Mexico, as far north as Wisconsin, Pennsylvania, even though we're headquartered here where I am in South Carolina. That means that not only do we need to be able to rely on technology tools like Microsoft Teams or Zoom to be able to communicate with one another in our teams. But certainly within the data and technology realm, we use electronic medical records, of course, to be able to take care of our patients. And with that information, as well as the ways that we partner with employers and health plans, we're sitting on a mountain of information. To be able to actually put that information into something that we can act on for the betterment of our patients, that means we, any one of these files that we deal with might have millions of records of medical claims or prescriptions that were dispensed or diagnoses that are coming out of the medical record system. So we have to be able to leverage technologies that we've purchased or partnered with other organizations, and many technologies that we built in-house as well, to be able to put that information to use, to be able to make sense out of a whole bunch of different data points.
So, what tech do you rely on to perform optimally?
That's a great question, Sal. So here we are Microsoft Azure shop. So we use a lot of different Azure services, from more old school SQL Server to, we've transitioned to Databricks for some of our processes as well. We have an in-house population health management application that we call Proactive IQ that we use to kind of supplement the information that comes out of the medical record system. And that's all hosted on Azure as well. What's interesting is now we're entering this age of AI. And so, we get a lot of requests of how do we start integrating AI into our workflows? Where are some opportunities that we can automate processes? So, I'll say at a minimum level, still use Excel as a large part of my day to day. But as we've kind of been progressing and maturing as an organization, right, it's moving beyond those spreadsheets into databases, into Databricks, and now it's the new frontier of, are there opportunities to incorporate AI tools into what we do as well?
Yeah, AI is a super big topic right now in healthcare. How do you see the adoption of AI happening? Because healthcare is usually one of the slowest industries to adopt to new technologies,
Listen.
but AI has such a profound impact in that it affects it has the potential to affect everybody's workflow all around the spectrum here. So my thoughts would be around how AI is going to be adopted. How's it going to be used? What are your thoughts around that?
Um, Another great question, Sal. You mentioned healthcare being slow to adopt new technologies, and I don't think it's necessarily that healthcare doesn't have its own fair share of technologists who are early adopters, but it's such a highly regulated environment. I think for good reason. So I get asked about AI a lot. Now I'll admit that well, I'll just confess I'm a nerd. I love playing with new technologies, but I tend to be a little bit more bearish on AI, I think, than even some of my peers within the space. Healthcare is not just a highly regulated environment when you think about it, typically for the protection of patients. Sometimes it's also just a patchwork of laws. But when you think about it, healthcare as well, there is nothing more deeply personal. So at the same time that, healthcare is typically a lot of families' single biggest expense, frequently more than rent or food. It's employers' biggest expense in a lot of cases. It's the country's biggest expense. I think everybody's looking at how do we make it more efficient? How are there opportunities that we can find to be able to leverage technology to reduce costs? And I think that's an absolutely noble goal. By minimum, I'm a bit concerned about the pace that AI is moving. Not that we're 6 months away from a Terminator scenario or anything, but I think when we look at what's happening with new AI technologies, everybody is very quick to say, how can this replace a human being? And are there jobs that are going to be replaced by AI? Absolutely. Are there plenty of jobs where it's not going to be highly disruptive, where either you've got an AI who's running Copilot, or in some cases the AI is taking over? Right or wrong, I think that's going to happen we're already seeing it happen. We'll definitely see more of it in the next couple of years. Where I get a little bit challenged is when I see companies that are moving to replace the provider-patient relationship with chatbot technologies. I think there's things that are so unique to what medicine does, what a healthcare provider or clinician does, that goes beyond just, all right, I'm going to take a bunch of input related to your symptoms and your vital signs, your previous diagnoses, and I'm going to spit out a diagnosis. Could an AI do that in the next 5 years? Probably. We're already seeing some of it today. We're seeing opportunities where AI can help radiologists identify spots early on that the human eye would have trouble detecting. I think, though, when you have a patient who goes into the doctor and maybe they're going in for a sinus infection, maybe they're going in because they sprained their ankle, and you have a trained clinician who's meeting face to face, whether it's in the room or even virtually like we're conversing right now, and they're able to see, they're able to detect human emotions, they're able to see what's going deeper. So I mean, we've had plenty of experiences just within our own company of patient comes in for one thing and we're actually able to diagnose not just some other medical condition, but behavioral health challenges that the patient is facing abuse at home, or we found patients who are living in their car in their employer's parking lot, just by being able to have an interaction. And I don't think the technology is anywhere near to the point where we can just replace what our doctors, our practitioners, and physicians assistants are able to do, what our nurses are able to do every day. So I do get a little bit nervous when we see the speed and pace that we're looking to inject AI into healthcare. But that said, I do think there are plenty of opportunities that it can do to enhance what our clinicians are doing today.
Yeah, let's talk about the enhancement part, right? A lot of what I've been hearing is that AI isn't necessarily going to replace any of the doctors or physicians or nurses, but it's gonna more look like a doctor with an AI co-pilot. What are your thoughts about just everyone in the healthcare industry having an AI co-pilot alongside them that can help do help the person that's doing the job do their job more effectively or efficiently, or just help with automating or delegating things at certain times?
No, absolutely. I think where we're going to see those AI co-pilots is all the tasks, the administrative tasks that come alongside healthcare and are required and increasingly feel like they're taking up more and more of the doctor's time, more and more of the patient's time. Ideas like intake questionnaires. Can you use an AI to be able to prompt the patient in advance to be able to have some kind of chatbot-like interaction for just capturing their insurance information, things like that. So by the time they come in for their appointment, it's less time for the patient, less time for the office staff. Absolutely. I think certainly the speed at which no physician knows everything. Many of our providers still rely on tools like UpToDate, Epocrates to be able to capture information, search for information, clinical pathways, treatment opportunities, medication dosing, or therapeutic substitutions. I do think AI is going to help us be able to search those things faster, as long as, again, we're checking sources and not taking the AI's word for it. And already we're seeing AIs being deployed within the exam room in a lot of scenarios. I've been to technology demos where the doctor has their phone in their pocket with one of these dictation technologies, which used to just be, I'm going to record my notes and hopefully it's going to show up in the word processor in more or less the same form that I entered it. Now we're actually seeing it be able to capture and summarize entire patient encounters. So the idea of you're just having a natural conversation with your patient when you're the physician, and then it picks up everything. It knows who's talking, and then it creates an encounter summary for that medical documentation that then the physician can review. So instead of having to fill out all of that template, it captures it, and of course is, again, very important, submitted to the clinician for review before it becomes part of the chart. I think those are opportunities, because I think where AI can help is for healthcare to be successful, for medicine to be successful and drive the best outcomes, you have to maximize the time that the clinician has with the patient, that the provider has with the patient. And I think so much about healthcare has been distilled down into, as the patient, you get maybe 5 to 7 minutes on average with your doctor. At our company, we have a minimum of 30 minutes. The goal is to be able to create space by removing the administrative headaches and administrative burdens so that there's time for the patient and the provider to spend together, to get to know one another, because that's when we see coaching can happen, true primary care can happen. The patient feels like they have a partner, not just a place they go when they're sick.
Super interesting. Let's talk about the tools. Because of all these tools and technologies, logging all these outputs, you must be generating a lot of data. How important is data analysis to you?
It drives everything that we do. So even before we go live with a new patient population, a new employer client, we're getting paid medical claims. Um, Medical claims, pharmacy claims, they're not a medical record. They're a record of a financial transaction, right? A doctor got paid or a hospital got paid for something, but we are able to glean some data points from that. We're able to see, okay, they went to the hospital for their diabetes, so we can infer this patient has diabetes. So we're using that before we even go live with a patient to be able to understand the population, what kind of healthcare challenges they're facing, so that we can equip our care teams to go live day one with knowing that there are resources, knowing who the best specialists, the highest quality specialists and facilities in a geography are. We're able to understand what's in the medication formulary, and of those things that are on the formulary, what's the least expensive. Your average clinician, provider, care team is not going to have they're not going to have the time to be able to research all this stuff on their own and start from square one. So what my data and technology teams do is take that information and be able to understand by talking to providers, by talking to our social work patient advocates, what is most important for you to be able to take the best care of the patient, and then being able to take that those millions of data points and distill them down into something that your average human being, right, doesn't require a computer, but your average human being can see when somebody's diabetes A1C, hemoglobin A1C is trending up or down over time. They're able to see when you've got a higher incidence of cancer rates and lower incidence of women getting mammograms or older adults getting their colon cancer screening. So being able to take that information and create something that's actionable that drives the strategy, that's where the magic happens, and that's where we're uniquely positioned versus your regular health system to be able to do that, because we have teams that are dedicated to it, and it's built into our model from day one.
Data. Are there challenges with analyzing all of the data you're gathering? Do you feel like you could be doing things better?
Yeah, I mean, the answer is yes. I don't think anybody's cracked the code to say, yep, this is it. We have the perfect tool. So constantly every day we're revising our analytics, we're creating new metrics, new types of reports. And then our data engineering team is also looking for, how do we do this better? One of their big accomplishments over the last probably 12 months or so is we've been rapidly growing as a company, and the technologies and the storage opportunities, the processes that you had when you're sitting on this much data may not necessarily translate to when you're sitting on tons of it. So that conversion to Databricks is moving. One of our nightly processes, the joke was we call it a nightly process, but it takes 16 hours to run, of being able to take that, which continued to grow as we scaled, leverage new technologies, leverage Databricks, our Snowflake backend as well, to be able to compress it into a couple of hours to be able to update that. So I think constantly we're fighting, and every company is fighting for, as we continue to scale, as we get deeper and deeper into analytics, our appetite for data just increases. And as our appetite increases, the amount we consume increases. And as we consume more, it slows us down, right? It's just like if I were to eat 12,000 calories today, I'm probably not going to operate that quickly. So we've got to figure out, how do we take that and be able to look for those new technologies. And that is an opportunity, I think, for artificial intelligence as well. We deal with hundreds of inbound and outbound data claims. If you ever want to blast from a past, talk to a lot of major insurance carriers, because we still get files that are from mainframes, right? They still call them the mainframe. These old COBOL systems from the 1970s that they've somehow managed to keep on life support for the last 40 plus years, with these old packed decimal formats and things like that you just don't see in other industries today. And I think there are opportunities, and we are seeing new tools of, well, AI can take that information and it can interpret it, map it, normalize the data, which is something that, a trained data engineer can do. But eventually you hit that point of scale. So are there opportunities for AI to be able to look at a data feed that has not been mapped, not been transformed, and be able to say, all right, we've got a large enough training data set. We're pretty confident that this 5-digit code here is an American Medical Association CPT-4 code. So we're just going to go ahead and classify that. I think that's something that we're starting to see new tools enter the marketplace that I'm excited to explore over the next few years.
As the old saying goes, if it ain't broken, don't fix it.
Yeah, that's true. I live by those words myself a lot of times, but at some point you're seeing these things break routinely. There's not always still that drive for these companies to fix it. So
is cybersecurity a concern for you right now? What measures are you taking to address those concerns?
Wonderful question. Cybersecurity is the thing that keeps me awake at night. When I started with Proactive, I built and led our data team, and then in 2022 took on the technology team as well. And I always joke I'm the guy who gets fired if there's a breach, so I do take it very seriously. I'm proud to say that ProactiveMD we just completed our SOC 2 Type 2 compliance for the first time, and so we've continued to take steps over the last few years of how do we continue to take a stronger and stronger posture every day towards security. I think there are companies that make the mistake of thinking that they are invulnerable, and I think you need only look at Department of Defense has been hacked, right?
Right.
We've seen cyber attacks against multi-billion-dollar financial institutions, healthcare companies. We're not special. We're not unique. So we have to take the zero trust approach to our security posture, which is assume your credentials. Somebody's credentials have already been violated. So what can you do to mitigate the impact that a malicious third-party actor could do? So for us, that means multi-factor authentication on all of our systems. It means we've got monitoring alerts, network security alerts, et cetera, that'll ping us if there's any unusual activity. We have data loss prevention policies in place, data classification that runs in the background, looking on this mountain of data to figure out, okay, are there files with social security numbers? If so, we need to go ahead and label them as such so that our data loss prevention algorithms can prevent them from leaving the confines of our secure environment. So I think cybersecurity is huge, and it's just increased in the age of AI as well. We're on the verge here of we're reviewing and we'll be rolling out an AI policy, because I think with so many tools available to people, right, it's only natural to say, hey, I've got a free AI note taker. It's going to make my life easier. I don't doubt that at all. The problem is that if you're bringing that AI note taker into a conversation where people are talking about patient information, names, date of birth, diagnoses, and then that information is being fed back into a training data set, you may not realize that you've just violated HIPAA. So for us right now, we're keeping those tools out. Those are not, part of our environment. But we are starting to explore. There are some HIPAA compliant tools out there, and very carefully and very judiciously starting to be able to evaluate them to see, can we bring these in without violating what we call our patient promise, which is that we're only and always about the patient. We promise to always fight for their greatest good. That extends beyond just what happens in the exam room. To me and my team, it means the security that we're being asked to be stewards of, the information we're stewards of. We have to keep secure. We have to be able to protect our patients from all the threats that are out there, internal and external.
It always seems to be coming back to AI. The threats from cyber are only getting more and more dangerous because of AI. And in order for everyone to be defensible, they sort of need to have to build their own AI defenses in place. So I'm pretty sure you're noticing the impact AI has had in the past year. Is AI currently a priority for you? And what things are you hoping that AI can solve for?
Um, it's I'm not trying to be pie in the sky around. Like I said earlier in the conversation, we're not anywhere close to a place where an AI can take the part of a healer, a trained healer like a physician or a nurse practitioner. Um, that said, I mean, AI is cool, right? I've absolutely used ChatGPT to say, okay, I know 3 years ago I knew how to write this algorithm in Ruby. I don't remember now. Hey, ChatGPT, can you write code that does this? And it creates it, and it works flawlessly. And I think there's so much potential to be able to automate some of those things that are much more routine tasks. Tell you the challenge that I want to solve for right now. I say time is precious to not just the providers and patients. I think time is the greatest resource any of us have. And so figuring out how are there tools out there that can effectively do something as seemingly simple as, hey, I have 3 people in my organization. Can you find time in the next 2 weeks and just schedule a meeting for us to do it with this subject? I've been evaluating some AI scheduling tools right now, and so far I haven't found one that can do that without randomly start speaking French or blocking the input or telling me you can't schedule a meeting, you're only a large language model. Why am I accessing you in Microsoft Outlook and you're called Copilot? So I think understanding AI, I think number one is understanding the threat that AI can bring to patients and security, and being able to defend and posture ourselves as quickly as we can to prevent against that. I think number two, then beyond that, is how can we use this to make our doctors' lives easier, or nurses' lives, or my life easier, for some of these kind of repetitive routine tasks, to just make us more efficient, so the time that we spend at work isn't spent looking at, a scheduling assistant and trying to book time. It's just being able to offload that to the AI copilot, say, go book this meeting, right? So I can focus on what matters most, the things that my primitive human brain is maybe better equipped for than a computer at this point. And I think that's true across our organization.
Yeah, AI is definitely here, but I could definitely agree that it's very janky right now. It kind of reminds me of almost the Flash days, like when every browser was having some sort of a Flash application. It was like, what's going on? Like, is this supposed to be great? No. Eventually, they got rid of Flash, but hopefully
Oh,
not.
but I mean, I
Yeah.
I can say this about Flash because I, in a past life, was a web designer back in the early aughts, and um, there was something beautiful about Flash as that new technology, and you did see all the interactive menus that you hadn't seen before. But I think just like AI, we got caught up in the sparkle, and then the security challenges that came from Flash. We would spend the next 2 decades trying to mitigate and remediate. So maybe AI is in the same place. I definitely like that analogy.
Well, finally, what message would you like to leave our listeners with?
Um, I think it's, to your listeners who might be thinking about adopting AI, or maybe who are working and developing AI, don't forget about the human touch. I think the key thing for us in healthcare is, as we've seen the corporatization of medicine over the last few decades, the human touch is what is disappearing more and more. And I think what patients are more and more wanting to recapture and feeling their frustration. So look for opportunities to use and develop tools that are going to be able to enhance that relationship, not replace it, not take away from it.
All right. Well, wow. What an adventure. My concluding thoughts are that AI has a big role to play in healthcare this year. Implementing AI really well will provide the most impact out of anything. It was such a pleasure having you on the show, Jeremy. Thank you for coming on.